Right, I'd like to say good evening and welcome to everyone. It's lovely to see you on this wet and miserable day here in England, but I know in Scotland, as we've heard, the weather's been beautiful. So tonight, I'd like to introduce you to Suzanne Lester. We met Suzanne, I think, a couple of years ago when the sun was shining, pre-COVID, and we made a recording. And the recording is on our Kinship Facebook page and also on Suzanne's website, www.sweetfamilies.com, and we'll come to that afterwards. So if you want to catch up with the details of family filial and filial therapy and also TheraPlay, Suzanne has lots of toys and lots of information on our previous one. So please go and take a look at that afterwards, or you can look at it on our Facebook page and let me know if you can't find it. So good afternoon or good evening now. And how are you? And how are you?
I'm very well, thank you. It's very nice to see you again. It seems a long time, but it's very nice to see everyone again.
It is.
A lot's happened. It's been a very tricky year and a half, hasn't it, for us all?
Well, it has been strange. Would you like to tell everybody a little bit about you? Because I'm sure many people here in the group haven't met you. Okay. So if you'd like to say who you are, where you're from, what you do.
Okay. So I'm Suzanne, and I'm currently a play and filial therapist. So before that, and I know, because I know Enza's going to ask me some questions about more details about what play and filial therapy is, so I won't go into that too much. But in my past life, I was a teacher. In fact, I started out as like a support assistant in a school, working with children with special needs. And then I went on to become a teacher, and then I kind of went back really to work with children who've got difficulties. And I found that, you know, as a teacher, I couldn't find ways for some children to be able to access the learning because their emotional needs and behavioural needs were so big. So it sort of struck my interest, and I started to research onto different sort of ways of being able to support children. I came across play therapy, and it sort of just clicked with me really, you know, and I found that, you know, to give a way for children and even young people that can't put into words how they feel, to be able to play out those things that they have got building up inside them, either because of their history or, you know, and not have to sit down and talk, you know, asking children sometimes, you know, tell us what's wrong, you know, how are you feeling? It's too hard for them to actually access that. So I got to know about play therapy, and I retrained to be a play therapist. And since then, I've trained to be a filial therapist as well.
Thank you. Thank you. Can you tell me what is a play therapist?
What's a play therapist? Well,
what is a play therapist?
It sounds fun, doesn't it? Because it's got the word play in there, of course. And sometimes people say to me, "Oh, it must be great. You just play all the time." Well, yeah, you do. You use play because for children, like I've already said, really, I suppose for children, being able to put things into words is quite difficult. So as a play therapist, I create the right conditions, if you like, for children to and provide the right equipment for them to be able to use it to tell me and talk about and think about how they feel. And so they often use ways of playing that out. So it could be that they will symbolize how they feel more than directly say. And for me, it just clicks really, you know. So I suppose the most important part of my job is the therapeutic relationship that I have with the child. And quite often, a lot of the children that I work with have had very difficult, challenging histories. And so they find it really difficult to trust someone to talk about or even to play out how they feel. So, you know, the first few sessions for me are all about getting that relationship right, so that they can trust in order to be able to work with me. So for play therapy, it's about usually it's a weekly session.
Mm-hmm.
The amount of sessions a child needs is quite dependent really on a number of factors, really. How long the difficulties have been going on for, how intense those difficulties might have been, you know, how closed off they are. So for some children, they might only need 12 sessions. That would be thought of as a sort of short intervention. So they may have lost someone in their family, they may have, but they've still got a secure attached family so that can support them. And then for other children, they might need more than that. And so that might be, in the 20s, and for other children, it can be significantly longer.
Thank you. And what about filial therapy? Because that's quite a new word to many of us.
Yeah, it's a strange word, a strange old word, isn't it? I mean, it means family, and it means it's like an extension of play therapy, really. So I've just described to you as a play therapist, it's me and the child in the room, and the parent or carer is not involved directly with the work. I would have review meetings with them, sort of every 6 to 8 sessions, and talk about what's been going on in the sessions and how you can support the child at home. But mostly it's just me and the child. Well, for filial therapy, it's sort of I'm stepped back from that, and I teach the parent carers the skills in order for them to hold what I call a special play session. So I'm not teaching the parents to be play therapists, but what I am teaching them is some therapeutic skills that will help their child, but they still use play as the way of being able to express that. So I help them to be able to set that play session up, and for them to be able to learn some specific therapeutic skills in order to run that special play session so the child can help. And so, really, I guess, it's about helping that relationship, but it's also helping the parents or carers to understand what certain types of behaviour might mean. So today, for example, I was doing a parent consultation following an assessment that I'd done for a boy, and talking to his new adopted dad. And, I was talking about his behaviour being quite toddler-like, and he's an older boy, he's 9. And that, sometimes there's gaps in children who've had a lot of neglect, and there's lots of gaps in their history. And for him, that was quite enlightening, to be able to think that at those times when he's like that, we need to actually speak to him like more of a toddler and manage that in that way. Not all the time, but at certain times. So, for me, it's about helping the adult, the carer or the parent, to be able to understand what the child is trying to express, sometimes through play. And then we'll look at how the sort of phases in filial therapy. So the first is like an assessment, that I would do an assessment on the child and the family, and then some training and a demonstration of a session, so they can see how the skills might look. And then I observe some of their sessions. So they do the play session and I observe. And I'm sure you're going to ask me some questions about remote working, so I'll hold that that bit back so I don't repeat myself. So I observe for so many sessions until the family feels confident in using those skills, and then we look at how to transition some of those therapeutic skills that they've learned in play therapy, in their filial play, into everyday life. So how can one of the skills, for example, is structuring, and how to structure a situation and how to help the child understand that. And it might be that very same skill can be used at bedtimes when he's struggling to go to sleep and get into bed and have that routine. So that's that third phase of filial, which is about transitioning those skills into everyday life.
So would you say you do the play therapy and then filial therapy after, or can you do either?
It's a good question. There's not a one answer to that. It depends very much. So, for example, if a child is displaying current trauma behaviour, they're still struggling with the trauma that they've happened, then filial could be really difficult to start with. So I would probably start with filial therapy at that point. Or if the parent or carer feels that they're overwhelmed by the behaviours, etc., then I might start with play therapy first. But if the carer or the parent feel that they want to get involved and they feel that they're keen to do that, and the child is not displaying current trauma behaviour, then I would start with filial. And at the moment, currently, of my caseload, just to put it in perspective, I've got 3 play therapy cases and about 12 filial. So the majority of my work at the moment is filial therapy, and I like filial therapy. obviously like play therapy at certain times when children have got trauma, then that needs to happen. But filial therapy for me empowers the parent and the carer. It makes them feel, and when I've gone away, you know, the child doesn't make the relationship with me in filial. It's about me helping, almost being a conduit really, and helping the child and the carer or the family to grow that attachment and that bond together. Whereas in play therapy, it's very much about the relationship between me and the child in terms of trust. Whereas for filial, I'm very much at a distance, and for children moving on, that is really helpful. But the second part of that answer to that question is that quite often when I've done filial, done play therapy, I will try and do filial as well, so that, you know, the parents do feel empowered really, you know, with their own skills to manage situations and not feeling like it's almost magical, you know, it's somebody else is doing something, you can do it.
Yeah. And this is a question about remote working. Does it work remotely? Can you do it remotely?
When before lockdown, I've not worked remotely with children at all. I've always done some remote work with families when I'm doing filial therapy, mainly from a purely practical point of view. So, you know, you guys will all know how busy family life can be. So sometimes the only time for me to have a parent consultation with the family is in the evening. Or they might not have very much time. So doing it remotely, I've often done evening work to make sure it fits in with the flexibility of families, really. But then when lockdown came, it's something that I had to kind of get my head around, really. And all my families that I was currently working with agreed and signed to say that we agreed for me to do all the work remotely for filial. And actually now I'm staying with some of those methods. And I'm doing it for a number of reasons, really. One is that it's very convenient for the families to do it that way. Sometimes the sorts of children with the difficulties I work with, when I go to a home to do an observation, for example, the child is very influenced by me being there. They've had a lot of professionals in their lives, you know, and so, you know, a recent one that I did, you know, children can very much perform for a professional, and they'll either act really good or they'll play up, you know. Either way, you know, you speak to the parent, okay, after, and say, is that normal? Well, not really, that's what they do for professionals. So me now, I do all my observed sessions remotely, because I've found and families have told me that they have found it better in that way. So and I do all my assessment, observed assessments remotely as well. The one thing I don't do, and I don't particularly feel comfortable with that, is play therapy remotely. For many reasons. You know, again, what I said about the fact that most of the children that I do play therapy with have got, you know, significant trauma and neglect issues, doing that remotely when I'm not there to hold them and to contain those things. I don't mean physically hold them,
No.
you know, emotionally hold them, and be there and be present is very difficult to do. So throughout the whole of lockdown, I continued to have a session with a boy that I'd worked with for quite some time and still do work with him, although I'm back to face with him now. With the parent with him, I just did some games sort of thing, really, in connection, just trying to keep the connection, really. I don't feel personally comfortable with doing play therapy remotely at all. I'm not sure it's safe to do that and effective. But that's my own view. You know, other people do it. So
yeah, I'd say you can't really play. They like computer games. They don't like people on there, do they? What sort of age would you say is the right age for a child to attend play therapy sessions?
For me, it's not so much about the actual chronological age as much as the developmental age. So chronologically, I've worked with children as young as 3 or 2.5 actually. I don't get many at that age, and I've worked with, you know, right up to 14, 15-year-olds in play therapy. I've worked with older children with a different model, but with play therapy to you know, 13, 14. but developmentally, she wasn't that age. You know, developmentally, she was much younger. And like, you know, I've just mentioned before, some children who have suffered significant trauma, abuse, neglect will have real big gaps within their development as well. You know, so I don't know if anyone's ever come across the Adoption UK have a wall as an image, and on each brick in the wall, it shows different stages of a child's development as they grow. And when children have had significant trauma, neglect, etc., some of those bricks are kind of missing. So it makes the foundation quite wobbly. So one of the great things about play and filial therapy is it allows children to go backwards and to fill in some of those gaps in their development, you know. So they might be, you know, very bright, they might be doing really well at school, but actually emotionally they've got some gaps that they need to fill in, if you like. And I find that works quite well, helping them to do that. So I wouldn't ever say no. I mean, some play therapists do work with adults.
All right.
I don't. That's just never been something that I've ever followed through with that. So there's not an age gap, really. There's not an age limit, really. If I'm working, I'll just add something to that though. If I work with an adolescent, so I've quite a few children who are around that 12, 13, but their feeling is that it's too babyish for them. So what I always do is I set it out a bit differently. So I have a bit more craft things and make it look a bit more grown up. But the things that they might feel are babyish, that they're still there for them.
Yeah.
And what they tend to do is they start with all the more art therapy, crafty kind of things. But then as they trust that relationship, they start to go to what they need to do, you know, and they'll go to the more younger kind of play if they need it.
So does the play therapy fill those gaps, those building blocks are missing? Does it help trigger them or fill those gaps up? Or
yeah, I mean, it can help access all sorts of different thoughts and feelings that are going on. And so children will often start playing with something and you think it's just normal, if you like, child play, but then it goes into a different direction. And it's so because like play therapy works within the unconscious as well as the conscious. And I think that's what's really clever about that, you know, that they wouldn't, if you ask the child, you know, why are you playing at, you know, the mum and the dad fighting or the, you know, this happening, they wouldn't connect that together. But actually when it comes out, it's all about an emotional response, and it does sort of allow them to be able to do that. So it's really useful for children going backwards and being able to, particularly one of the things I notice a lot is sensory difficulties. So a lot of children that have difficulty with self-regulation, you know, managing their feelings, managing their emotions and their behaviour, is quite often linked to a sensory gap as well. And that is because when children are very little, from birth really, you know, the fingers are in the mouth, everything goes in the mouth, doesn't it? It's a very sensory period of time, you know, and when they're then a bit older and they're sat in the high chair and they're eating and everything goes in the mouth and, you know, everything's being, it's a very sensory time. And if children have had a disruption during that phase and that stage in their development, either because they weren't being fed, they weren't feeling safe, there was too much happening, so that they won't have been able to focus too much on that, then that can cause a gap, and that would quite often show itself in poor self-regulation, that inability, you know, because when they are using that sensory things, they're learning what happens when this happens. It's cause and effect, you know. When I squeeze that happens, that's something. So they're learning an awful lot about, you know, that sensory feedback. When that's missing, that can often be later seen as that. So for me, play therapy allows them to go back, and so does filial therapy. And I often, when I'm working with families, will talk about sensory. It comes up in most families at some point, and we talk quite a lot about the need for them to be able to go back and get messy and to explore and experiment with all of those different things in order to, it's almost like backfilling the gaps, you know, in the development. So
yeah. I've heard from a few kinship carers that are kinship fostering that social workers are saying that it's not the right time for children to start play therapy while they're in kinship fostering. And they say, you know, it has to wait until the child's moved into permanence for this to happen. Would you say it is a good time because they are going, you know, obviously they've been removed for a reason. So would you say being in fostering, a child being fostered, is a good time to start play therapy?
It's really difficult and to answer it as a black and white yes or no. I think it very much depends on the child and on the situation. I've worked with children in foster care before, and to be honest, you know, I'll talk to you about a particular case without breaking any confidences, obviously, because it'll help illustrate what I mean. So a child was referred to me when I was actually working at CAMS, and she was 18 months old, 2 years, and she'd been deemed unadoptable. Rather than me working with her as play therapy, even though she'd lots of very, very challenging behaviours, I worked with the foster carer using the filial therapy model. And it was quite amazing, really, because she was so tiny, even though she'd had a lot of quite difficult things happen to her, she was also responded quite quickly to the changes of approach that the foster carer used, because, you know, it's different than typical parenting. You know, it is a different model. And actually, you know, so I worked with her for a while. I'm not for 1 minute trying to say I'm great at everything that I do, but this child then was put up for adoption, and she, you know, her behaviour had changed so much. So in that sort of situation, yes, you know, working with a child in foster care is appropriate. And because I was helping her to understand what attachment, that in a way, the foster care modelled a secure attached relationship for that child. And then she was able to transfer that when she was placed into her adoption placement. Whereas because she had no history of a secure attached relationship and what that might feel like. And so then she had a model for that. Some people find that difficult. Some social workers find it difficult to understand and feel like they need to wait to make that attachment relationship when they get with the person that they're going to be with permanently. The problem for that is a twofold, really. One, they haven't got a model for that. They haven't got a framework for what that looks like, you know. And also, it's sometimes the behaviour then such prevents that move into a permanent placement because of the behaviour being so challenging. So they never get that support. So I understand, and CAMS were particularly difficult to work for in those sort of situations because they had a blanket. The CAMS I worked for had a blanket policy of, you know, while things are up and down and there's not a settled period, well, they can't have therapy. But for some children, they'll never get to that settled period unless you do some work with them.
I totally agree with you there.
I feel we have to have some flexibility within. Yes, if there's lots of changes, you know. I've got a family at the moment that I've worked with for a little while, and then I'm now going to be doing therapeutic life story work. Talking with the adoptive mum, we're going to wait until after Christmas because they've got birthdays coming up. They always trigger things. They've got a letterbox that always triggers things, and they've got Christmas coming up. So I wouldn't, you know, let's wait until after when, you know, so that sort of thing. Yes, let's wait. But making it as a blanket statement that we're not going to work with children until things are settled or until they're in their permanent place doesn't always work. So for me, it's about looking at the case. You know, if that came to me, I would want to know all about the background before I'd make a decision about it.
So how about children that are already diagnosed, say, not just attachment issues, so autism or FASD or PTSD. So for those that don't know, post-traumatic stress disorders, PTSD, FASD is fetal alcohol spectrum disorder. So what about those children? Can play therapy and filial therapy help them?
Yeah, again, there's all sorts of different degrees within that, isn't there, of difficulty? For me, the diagnosis wouldn't prevent me working with them. Children that are on the spectrum, the SD spectrum, sometimes find the non-directive play therapy quite difficult. That, you know, they don't know how to play, if you like, and so they haven't got the imagination to use things symbolically to express themselves. And actually during lockdown, I did a course called Ought to Play, which is specifically, so it's a bit more of a directive play therapy approach. And so that works more specifically with children with high functioning ASD. And so the approach is slightly different. So the same things that I would normally apply, my core skills, if you like, are the same. But these children sometimes need a little bit more help in order to do some of those things. So, you know, they need a bit more help to be playful, or a bit more help to make eye contact. And so that's a model that I've only just recently added to my skill set, if you like.
Yeah.
But, you know, all the rest, the PTSD one, you know, I would probably be looking at play therapy because it's a trauma related difficulty. You know, I'd probably think about play therapy first.
So is there any child that, or any diagnosis that you can't or shouldn't do play therapy with?
I don't know, not sure really. Probably
Not come
not
across
that
it.
I've come across it, no. I mean, obviously if you work with children with physical difficulties, then you've obviously got some access issues there, but none of those you can't get around them. You know, as some people, children with allergies, again, I have to be a bit more careful about the sand and some of the materials I might use, but they're just making adaptations rather than not doing that.
Our kinship children, as kinship carers, we have children that meet lots of different social workers and have met lots of strangers throughout their time and been questioned over and over again. Some more than so than others. So how do you gain their trust? Because they're quite untrusting of adults. So they will, like you said earlier, they will portray something different to you because you're a stranger.
Yeah.
How do you help these children to trust? Or do you do that with filial play?
Mostly if you're using the filial model, that they, you know, don't really need to trust me. The carer needs to trust me and trust that the skills I'm teaching them will be helpful. And, you know, even though they feel a bit different and a bit strange sometimes, they are, you know, they need to trust me. But for the children with filial, really, I don't particularly, you know, so what I would be doing is helping the adult that cares for them to help them understand the therapy process and to be able to trust them. So, for example, we, you know, things around confidentiality, for example, and this applies when I do play therapy. I always make sure that the children know that, you know, I won't talk about the things that you play out. But if there's things that if I'm worried about your safety, then I will have to talk to someone, but I will let you know beforehand. And when I'm feeding back information to families, I don't say, you know, he played with this and he did this and I pick out the themes of the sessions from a number of sessions to see what he, you know, and it's not necessarily that they're playing with something like this or that. It's more about those emotional responses, you know. It's finding it really difficult to keep on trying, you know, gives up easily because he feels like he'll always fail, you know. And I always talk to the children about what I'm going to say beforehand. So that's the model I use. And, you know, when I'm doing play therapy, it usually takes about the first 2 to 3 sessions, usually, even with a pretty mistrustful child, before they kind of relax. Before that, they're sort of testing me out. But the whole play therapy and filial therapy model is very much about keeping everything the same. So in the therapeutic time, you know, for me, for an hour for play therapy or about half an hour for filial therapy, you know, it's about, you know, making sure that everything stays the same. So it's, you know, I encourage families to always have the mat in the same place. So the child then hasn't got to worry about anything else. Things are going to stay the same. The toys will stay the same and I'll stay the same. And that helps to build that trust.
Brilliant, thank you. We'll leave some questions in a few moments, but I've just got a couple of things to ask. When we last met, and I know I often go on your website, so I know the answer, but you did something called the Magic Box last time, and I know that you're still doing that. Would you like to explain what the Magic Box is?
Yeah, I will first say I haven't done a lot on my website for a while. I've been, things have been difficult and busy, and making resources takes time. So, and at the moment I've been asked to write courses as well in terms of training people. So that's been taking more of my time. But anyway, Magic Box is, like, you probably have heard of it, called a calm box. So, it's about just having some things in a box really that the child can use to help self-regulate. And I've written a guide, because it's really, it's not just about putting some squishy things in there. It's about, how you talk to the child about it. It's about how, where it goes, the box, how you use it, as much as what's in it. But the basic principle is that, you're helping children realize that sometimes when we're feeling a little bit wobbly inside, sometimes doing something, either colouring, can help calm us down. You're trying to get that message. It's a bit more of a CBT model, really. As in cognitive behavioural therapy, which is, about being able to help children recognise what their thoughts are, and the link to their feelings, and the link to their behaviour, and that cycle, and how that works. So a calm box is a really easy thing that you can put together. I would recommend you read the guide, because it's the success is more dependent on how you do it, rather than and what you say to the child. And I have put in there some of the skills that I use in filial as well, like about how to use reflective language and therapeutic language to help children think about how they feel. So rather than asking them a direct question, you might just wonder, I wonder how that might feel, rather than how does that feel,
So we can find those on your website, and it's a little self-help box with instructions on how to use it. Yeah,
I mean, I don't provide you the box. I don't.
No.
It's just the information that you're going to get from me. But it's a nice addition, and a lot of children benefit from it. And quite often it's, if you can help them recognize the early signs of that dysregulation, so there's a few activities on my website about how to help children understand. So when they feel something in their body, what might that be, and what emotion might that be, so it's a lot of work around emotional regulation and how to recognize that in your body, because if you can recognize that in your body, then you can do something before it gets too big, So I keep meaning to do a drawing of this, or one of my brothers mostly does all the artwork for things, because he's really clever. But it's not like the lemonade bottle, really. If you think of a lemonade bottle, if your worries and your things going wrong build up inside, and you don't have any vents coming out of this lemonade bottle, and all that pressure builds up, and suddenly it's phew. But actually, the big explosion of whether that's a tantrum or a rage or what that might be, might actually have only been one tiny thing that happened, but it wasn't that, it was the build up. So helping children to recognize when it's starting to build up and do something to help it, then is probably what that's based on, really.
I like to call it the champagne bottle effect.
Oh, well, that's much
it pops and spreads everywhere.
I'm a northerner, it's lemonade.
Yeah, not that I get champagne, but the hints there. You also offer sorry, you heard that one. You also offer some free resources as well, some flyers and posters.
Yeah,
so
they're all there. Just download them. It's easy, again, like I said, I haven't put anything fresh on there for a while, and I know I need to, and it's there in my head. But help yourself to anything, and message me, if you want to, again, same with the Facebook, Sweet Families Facebook. I haven't been as good at keeping on top of it, but I will reply to messages if they come to me.
So sweetfamilies.com and Facebook sweetfamilies.com. Right, I'd like to thank you for giving us your time and giving us a deeper insight into play therapy and physiotherapy, and it's lovely to see you, and thank you, and good night. Lovely to see you.
Thank you.